To achieve the project's aim, the following intervention steps will be implemented. The first step is to gather CAUTI rates and use this as a baseline measurement for analysis and comparison throughout the implementation process. The second step is to observe the nurses and physicians' caring methods for indwelling urinary catheter care. This step will allow the unit manager to see what actions are causing CAUTIs. The observations will show that the contributing factors are poor use of aseptic technique during initial catheter placement and lack of urinary catheter daily maintenance. These factors are a result of inadequate training and education. To solve this part of the problem, training and education will be another step, a part of the intervention process. The training and education will be delivered by the hospital's infection control nurse. In-person training will take place the first 3 weeks of June. After that, online modules will be available until the end of September, which will be the end of the project. Education information will cover proper aseptic technique, methods for daily catheter maintenance, and the importance of CAUTI reduction. Corresponding reading material will be provided for future reference. Demonstration is another intervention step that will show nurses and physicians proper aseptic technique, catheter care, and how to perform daily urinary catheter assessments. Demonstrations will be performed through mock patient scenarios and modules for learning and experience. Urinary catheter assessments will discuss guidelines on how to assess whether a patient needs a urinary catheter, when a patient no longer needs a urinary catheter, and how to evaluate for signs of infection, which will occur twice per shift. Assessment for infection will be performed twice per nursing shift, so if an infection does occur, treatment can be started as soon as possible during the early signs of this infection. Another intervention step includes criteria-based reminder sheets, which were created by the CDC. It calls for physicians to complete a daily assessment on each patient with an indwelling urinary catheter and state whether this patient still requires a catheter and why. The options for keeping the catheters placed will have to meet the CDC guidelines. If not, catheters will be removed because it's no longer beneficial for the patient or safe. If catheter is no longer needed, this step will encourage nurses to perform early catheter removal before the 7th day of placement to prevent CAUTI development. The CAUTI occurrence sheet will be posted in the unit's nursing station, where nurses and physicians will have to record if a patient does develop a CAUTI, when the infection occurred, and if CAUTI care was continuously performed. These sheets will be monitored by the unit manager at the end of every shift. The CAUTI occurrence sheet and criteria-based reminder sheet will be used as a data collection tool for the entire process.